Hi, my name is Susan Huntress, and I'm going to be presenting my pocket guide. Here it is. I'm planning on using it next year. My organization is Adult Primary, Women's Health, Pregnancy Care, Pediatrics, and Geriatrics. I start out with the adult health, and I start out with the list of vaccines, when to get them, how old, and what vaccines they need. I included influenza, tetanus, measles, mumps, and rubella, varicella, zoster, HPV, and pneumococcal. I included some charts. This is the blood pressure chart, the BMI scale. I also have the Bristol stool chart. My first section in the adult medicine is how to do a physical exam and the steps that you take. You start skin, head to toe, head and neck, eye, chest and lung, cardiovascular, abdominal, musculoskeletal, neurological, and urinary. Here's some more charts that I used to remind me on how to do this head to toe exam and the tools I need, the nose and the sinuses. You want to palpate the sinuses, and you want to use the otoscope to look inside the nose and check the structures of the nose and the turbinates. Here's a little cheat sheet for the lymph nodes and where they are. I included in how to do the thyroid exam and check the joints, and then tips on how to do the eye exam, the reflexes I'm looking at during my eye exam, and how to do it like the darkened room and what I'm looking for. And then the chest and lung exam, inspection, and palpation, percussion. Here's a picture of how to do the percussion. This is a sequence that you're going to do for lung exam. I'm listening to the lung sounds, normal lung sounds, what they're called, tracheal breath, bronchial, vesicular, and vascular breathing. And these are the adventitious sounds, crackles, wheezes, and bronchi. More about doing breath sounds. And also palpation, voice transmission, tactile, and bronchoscopy. Cardiovascular, you want to check all the pulses, the carotid, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis, and I wrote down where they are. And then this is the scale that you would use, 0 through +1. The heart sounds, the lung sounds, S1, S2, and S3, and S4, and where they start and what their sounds are. Abdominal exam. And this is palpation of the abdomen, and the neurologic exam. And then I move on to women's health. And I have the current combined screening guidelines for the pap smears. The recommended time for mammograms and self-breast exams. GYN exams, signs and symptoms, the things that we're going to review with our patients. I included information about PCOS, how to work it up, and what you need and how to treat it. This is also important for your GYN exam. It's a menstrual period history. And then I included menopause, when it starts, perimenopause, how to do breast exams, plan of care for when you do have a lump, the Gardasil, recommended time for vaccines. And then I move right along to pregnancy care. This is my area of expertise. I have a chart of the baby growth. And then from implantation to birth, I have another chart. So we're going to start with preconception counseling, what you're going to be looking for, and the supplements they're going to need, and the medication they're going to take. And we're going to have pregnancy, how to diagnose it, and then the dating using Nagel's rule. This is fetal development chart by weeks. I also have the schedule of OB visits, Q4 for 28, up until 28, every 2 till 36, every week until term, and twice a week after your post dates. When you have a vaginal delivery, you see the doctor in 6 weeks, and a C-section, 2 weeks. Here's also a definition of the trimesters, first, second, and third trimester. Some more pregnancy stuff, gestational hypertension, that's hypertension that's diagnosed during the pregnancy with the absence of protein. Chronic hypertension, preeclampsia, early, late, and chronic hypertension again. and then more about preeclampsia, preeclampsia with severe features, and then eclampsia. Then I move on to labor signs, labor support, and then we move to pediatrics. First, this is all the things you're going to include in your pediatric evaluation. And then I start with the newborn assessment, and then the milestones that they're going to meet each month up until 12. Infant starts birth to 1 year, toddlers 1 to 3, and then preschool and so on. I have it all listed right here. Here's the, some examples of the reflexes that we're going to be looking at for the newborn. Yeah. And then we're going to go into nutrition. We want to make sure the baby's getting enough formula and when to start vegetables, fruit in the order to do it, and then table foods at 8 months. Here's some more milestones, and then I cut out each one, what to look for 1 month, 2 months, 3 month, 4 month, 5 months, 6 month, 7, 8, 9, 10, so that we can see if the baby's on track. At each newborn assessment continued, I'm going to check to see the weight, and by 2 weeks they should have regained their birth weight. It doubles by 6 months and it triples by 12, and then the head circumference is also measured, and this is the rate of growth, up 2 centimeters a month from 0 to 3 months, 1 centimeter a month from 3 to 6, 1 centimeter a month from 6 to 18 months. Some more newborn assessment tips. The abdomen all the way down, and then make sure you find out about their elimination pattern. And then I went more into each age group, toddlers, what their milestones are, and more about timeouts and discipline a toddler, school age, and the physical exam for a school age child, and just their social skills that they're working on. And then I went into adolescents and how to do a physical exam on an adolescent, and the most important thing is to conduct the exam without the parent. And then just more tips on how to do it, like be sensitive. Early adolescence is 12 to 14. Middle adolescence is 15 to 17, and just more things that you're going to look for with the adolescent. And then middle-aged adolescent, and middle school adolescent, late adolescence, and then after I go to geriatrics. And then I classified each age of geriatrics. And the components of a well elder exam, what you're going to look for and what you're going to interview the patient as. You're going to do a functional assessment, and you're going to do ADLs and independent ADLs. You're going to ask about falls. You're going to assess elderly driving. These are the cognition tests that we got given to us on our in our slides. Cognitive functioning, we're going to check that on the elderly. We're going to also do the depression screening. Here's some more tips from the slides. You're also going to check to make sure that they don't have polypharmacy, because it increases the risk of adverse drug. There's many drug interaction, falls, and hip fractures. We're going to avoid all that. And then little tips on the principles of safe prescribing, and then the Beers list criteria, to make sure that you weigh the risks and the benefit for each medicine and have a discussion and make sure that it's safe for your patient. You're going to do nutritional assessments, and then nutritional considerations, and then immunizations for the elderly patient. Also the MOLS, which is the Massachusetts Medical Orders for Life-Sustaining Treatment, and you're going to go over like Advanced Life Directive and the Living Will and the Healthcare Proxy. And that's my pocket guide that I'm going to utilize next year. I also, I'm going to submit my references on a separate piece of paper, and thank you. Have a good Easter. Bye-bye.